Hi, good evening. We're here at Santa Cruz Valley District Boardroom to discuss the COVID-19 vaccine. We'll be discussing the vaccine as it relates to just vaccine in general, but also we'll be discussing more specifically the vaccine rollout of the 5 to 11-year-old vaccine. We are joined here tonight with Dr. Williams from Mariposa and Dr. Pereira from Mariposa. Dr. Lunderville, who has been the district point of contact for all of our COVID protocols. So tonight, again, we're discussing the rollout of the 5 to 11-year-old. So with that, we also are welcoming questions. So we'll have some live questions that will be coming in. We also sent that out earlier for people to send in questions if they had questions about the vaccine. So let's just start out with the 5 to 11 vaccine has been approved. So if you want to share some information of just the vaccine in general for the 5 to 11-year-olds.
So I'll begin with a couple of comments, and then Dr. Williams will expand. I want to thank you and the district for inviting us one more time. We're delighted to be here, and thanks for the opportunity. So the FDA approved the Pfizer vaccine 5 to 11. It looks effective and safe. Now it goes to CDC, ACIP, the Advisory Committee of Immunization Practices, and CDC later this week. More than likely will be approved. Dr. Rochelle Walensky will sign off. So we'll be ready to vaccinate on Monday. So that happens likely Thursday or Friday. We'll be ready Monday. We hope to be at the rec in Nogales starting around noon. We chose that time to accommodate the school so that children don't lose the school. But as we discussed earlier, our plans are very fluid. We can adjust. If we feel that the community wants us to be there at 8, we can be there early. But we hope to be there at noon. We'll go to about 6 or 7. We'll have the Pfizer vaccine for children. We also have the Pfizer vaccine for any adult of any of those children who remain unvaccinated. So we want to target the kids, but as we know, one of the best tools to keep our children safe is the adult Pfizer vaccine. We're going to be there the 8th and the 10th for children, and then we'll be happy to share with your schedule for the rest. We think there are about 3,000 children in the county who may benefit from that. Maybe more, we'll find out, and so we'll be there. I'll pass it over to Dr. Williams.
I think that you summarized it really, really well, Dr. Pereira. But the Pfizer, they completed the 3-phase clinical trials for the age group of 5 to 11. And in the initial study, they looked at over 2,200 kids, and some of the ongoing studies have really had over 5,000 kids that they've studied. And the studies are showing that the vaccine is incredibly effective. It's almost 91% effective in terms of preventing symptomatic COVID. It's a 2-shot series similar to the adult vaccine, and it's 21 days apart, also similar to the adult Pfizer vaccine. But the dose is slightly different. The dose is it's actually 10 micrograms, which is a third of the dose given to adults and teenagers. The reason why they did that is that they looked at several doses. So they looked at 10 micrograms and 20 as well, and up to 30 micrograms. And they basically saw the same immune response in the 10 microgram amount with less side effects. So you can get the same immune response with a lower dose, then that's what we're going for. And the good news is that they have not seen any serious side effects with the vaccine for kids. Myocarditis is something that a lot of you may have heard of, and specifically for myocarditis, it's kind of interesting. If I can just kind of briefly touch on it.
Yes.
The American Academy of Pediatrics, they recently came out with a statement specifically of myocarditis and the vaccine. And it's interesting. Well, first, myocarditis, of course, is inflammation of the heart. That's different from pericarditis, which is inflammation of the lining of the heart. Myocarditis is inflammation of the actual muscle of the heart. And the risk of myocarditis for kids under the age of 17 is 37 times higher in that population who are infected with COVID than those who are not. So 37 times higher if you actually have COVID infection. And when you look at the rates of infection, there has been a very, very, very rare association between the COVID vaccine and myocarditis, but it's extremely rare. For instance, there's only, roughly 39 to 40 cases per million of myocarditis in kids that haven't received the vaccine. But in comparison, kids that were infected with COVID, there was roughly 1,000 per million in cases. So 1,000 per million if you have actual infection, we're only 39 or 40 cases with the vaccine. So the vaccine is very, very effective, and just like Dr. Pereira said, we will roll it out as soon as it receives CDC approval. Really quick, there's a couple of important dates just to give you a quick timeline. So, on October 7th, Pfizer actually releases safety data, and they presented it to the FDA. And then on October 26th, the FDA, they recommended it. The 29th, the FDA, they granted the emergency use authorization. And then as early as tomorrow, the CDC advisory panel, ACIP, they're going to vote. And then the last step is Dr. Walensky, the CDC director, will likely approve probably on Thursday or Friday.
Great, that's great information. So again, wanted to let our audience know, and this will be recorded as well, so they'll be able to see it afterward, is that this is not a vaccine mandate. So we are not mandating the vaccine. It's not something that we're requiring for any of our students. And so what we wanted to do is let the parents know, because I know there's a lot of questions about it. So if it's not required, why should I get the vaccine? What would be the benefit for my child to receive that vaccine?
I think before we talk about that, I think it's really important for everyone to know exactly what COVID does to the body. Because in my opinion, before you start talking about the effectiveness of vaccine, we really should focus on what actual COVID infection does. So just give me just a couple of minutes. So, what the virus does, it basically attacks the mucosa, which is basically the lining of specifically your eyes, your throat, your nose, your mouth. And what it does is that it basically hijacks those cells, and it starts to create large copies of the virus. And what differs COVID infection over the common cold is that typically if you have a common cold, it typically stays in what we call the upper respiratory tract. So that's typically, again, in the nose, in the mouth. Whereas COVID has it actually goes to the lower respiratory tract. So what does that mean? That means it infects the lungs, and it can affect other organs as well. So basically what the body does is that it tries to mount an immune response to this mounting infection. And in response, you have lots of inflammatory markers that are created. And basically you have inflammation that can cause something called ARDS, which is acute respiratory stress syndrome, which basically causes stiff lungs that are filled with fluid. You also have a risk of pneumonia. Pneumonia is an infection of those lungs. And both the ARDS, pneumonia, it can impair oxygenation, it can lead to respiratory failure. And you may have heard in the news about something called cytokine storm. It's basically all these inflammatory markers that are released in very, 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 very high amounts, and they can then kill and damage the organs. So that's something that we know. That's something that we know that the COVID infection does. Thank God, though, we actually have something to counteract that, which is, of course, the vaccine. Just like we said, roughly almost 91% effective in preventing. And, COVID it's still here. As of October 28th, total cases, there's been 6.4 million kids infected with COVID-19. And just in the last week, Dr. Peter, there's been over 100,000 kids affected with COVID-19, just in the past week. And since September, obviously we had that huge surge in the early fall. Just in September, there's been 1.3 million additional kids that have been affected. And unfortunately, our vaccine rates are not as high as we'd like. That 12 to 17 group all across the country, it's only roughly 50% of that population that's been infected. Dr. Pereira and I were talking earlier, and he mentioned that the leading cause of death among police officers is actually now COVID. And it still remains, the sixth leading cause of death among kids. And overall, in terms of all population, we still have 1,000 to 2,000 COVID deaths a day, per day. And a lot of hospitals around the country are seeing that for those kids that are admitted to the hospital with COVID infection, up to a third, 33% of those end up in the ICU. So it's here, it's dangerous, it's wreaking havoc still. So of course, why should you get vaccinated? To prevent everything that I just mentioned.
Good review, Dr. Williams. If I may add, the outcomes of the trials were very specific. They look at severe disease, they look at hospitalization and death. And I think that's what the vaccine does the best. It reduces the possibility of you getting really sick, requiring hospital stay, and death. The other benefit, I refer virtually everyone to the Mayo Clinic website. They have some really nice reviews. Is that when we become vaccinated, we don't allow the virus to mutate. And then we know that Delta accounts probably for 80–90%. If we don't get vaccinated, we allow that mutation to occur. So that's another benefit of the vaccine that perhaps we don't see clinically, but we make it a little bit more difficult for COVID to mutate and become more resistant either to the vaccine or to antivirals. So I think those are the big three outcomes that look at trials, and then of course the mutation prevention.
And so you bring up another good point of one, the prevention, but then the big question is now we've had it in some of our adults that have been vaccinated, the breakthrough. That now I got it, doesn't guarantee that I'm not going to get it. So if I'm one of that 9% that somehow gets it, does it have any benefit for those that end up having a breakthrough and getting COVID-19?
Right. So what you're referring to is those vaccinated who become infected. We know the disease will be less severe. So there are many benefits to that. One of the benefits is not just illness per se in terms of morbidity and mortality, but also long-term, the so-called long-haul COVID. But it also affects the entire community. We do know that in some cases they can transmit the virus, but we still have very vulnerable populations that have not been vaccinated. We spoke about just before the session began, the 5 to 11. We know that that's really important. We can transmit them, and also those who are very immunocompromised too. So yes, we're concerned about breakthrough infections. There's no doubt about that. But we can do a lot of good by preventing severe disease. One thing we haven't spoken about that perhaps doesn't come on because we always focus on our patients, the people who we care for. But across the country, many hospitals are overwhelmed with the number of COVID cases. We all hear stories about patients waiting hours in emergency room, delaying surgery. So the consequences of COVID are not just clinical, but the burden on the hospital system is monumental. So there are just other issues in addition to the clinical component we just discussed.
So now we got a lot of benefit, obviously, from having it, and we talked about if they don't get it, what are some of the possibilities when you do contract COVID? Some of the questions that were presented to us is how safe is it for our children? Because I think that's always going to be, and I think you presented a good portion of that, but just to reiterate that question, how safe is it, based on the clinical trials and just what we know about the vaccine itself?
I think it's a great question, and fortunately the data has been excellent. So like we mentioned, roughly 91% effective. There has not been any cases of severe illness. Even cases of myocarditis that, like I mentioned before, that we're seeing with other adult vaccines, we've not seen it in the research group. So in terms of being safe, it is very, very, very safe, and it's been proven to be effective.
And so along with that, you mentioned that the dose is much smaller. So the question is side effects. What are some of the side effects, and will my child be monitored So if I go in and get the shot, I know there's a waiting period and to see if there's a reaction. But after that as well, is there some typical symptoms that they may occur just like in the adult?
Exactly, it's a great question. You know, not just with the COVID vaccine, but really with any vaccine, you can have what we call a mild reaction. So basically, as your body is building up what are called antibodies, antibodies are the things in your body which help fight infection. As your body is building up those antibody levels, you can have what a local reaction. So it's really common to have, you know, arm soreness, you may have a little bit of redness, some people have fatigue, you may even have low-grade fevers. But, you know, typically those symptoms resolve within 1 to 3 days. You know, it's not a exorbitant amount of time.
In the early observation, we have a 15-minute waiting period. Certain clinical indicators help us extend that to 30 minutes. Sometimes we waited another hour or so. So we're going to be there and monitor people for early symptoms. And so we have the medications that are needed to treat any possible concerns that we may have.
Another question, a common concern is people are concerned with infertility. So infertility or even delayed puberty has not been shown with this vaccine. And you know, honestly, you know, concerns with puberty and infertility, it's not just with COVID. Even if you look at the history of vaccines, it's also occurred. So for instance, when we gave the polio vaccine initially, a lot of people were really concerned that you would not be able to have kids. So all these are kind of common fears and common concerns, but thank goodness the researchers shown that no, it does not alter puberty, does not cause infertility.
So, Dr. Laura, any questions that have come up? Or
No, the questions have been primarily regarding the mobile clinics that the Arizona Department of Health Services is going to provide for us, so I can talk a little bit about that if you'd like.
Yeah.
All right. So our district will, of course, have 2 different options for families. The first, of course, is the Nogales Rec. That information we will send out. I'm sure that there'll be a link similar to what we've offered families to sign up and make their appointment. The other option is to have your child vaccinated during school, during the school day. And we will be releasing additional information about what that process will look like, but basically parents would give consent either through the QR code or the consent form that we have put out on social media and our website, and then the district would then take your child out to the mobile vaccine clinic, and they would be able to get vaccinated there. And we'll have both sets of information sent out in greater detail this week once we have all of the information. And if families have questions, they of course can contact, we'll have contact information for both.
And if I may comment on a couple of things, Superintendent, if you would allow me, about the boosters that are out there. So all 3 vaccines have been granted authorization for boosters. We know that boosters is to be given to individuals who initially develop a very good antibody response, but over time the antibody level drops, you know that, versus the 3rd shot, which is for the immunocompromised person who did not get that first antibody response or as good as other people. So for the Johnson & Johnson, the booster is recommended 2 months after the dose for all, versus the mRNA vaccines, which is Pfizer and Moderna. The FDA and CDC, mostly CDC, they targeted 3 populations, if I may. Number 1 is those over 65 years of age. Number 2, younger people, 18 through 64, who have chronic conditions. And there are a number of chronic conditions that we all know. Liver disease, kidney disease, heart disease, all of that fall into that category. And then the 3rd group is those people who are at high risk of COVID, due to a couple of reasons. One is our occupation. In this case, it would be educators who are in congregate settings, but also law enforcement, grocery workers. Those are individuals exposed to a lot of people every day. And then patients who live in certain residential facilities. Those are nursing homes, long-term care facilities, etc. So those are the three groups. So that's, I think, CDC just made a statement recently that about 89% of people qualify for a booster. The mRNA vaccine is 6 months for the booster, so that's a slight difference. I know this is a lot of information, but we're going to be there. If people have questions, they can ask us. We have access to various websites for immediate consultation. If we don't have the answer, we can look it up. We have other colleagues in Tucson or Phoenix that we can call to get answers. So we're here to help.
Great. So shifting a little bit, still with vaccine, cold and flu season is coming up.
Yeah.
So I know that it's been encouraged to get your flu vaccine as well. Is there any conflict between the two vaccines? Should there be a waiting period between, or is there, how should we approach that?
Right, so thank you, good question. So the influenza vaccine is approved for patients who are 6 months of age and older. At the rec, we're going to be doing influenza vaccines as well, but only for those 18 and older. The younger kids will be at the clinic. The vaccine can be given at the same time, different arms. It could be any of the 3 approved vaccines with the influenza and the COVID-19 vaccine. But if anyone wants to wait, they want to get 1 shot today and 1 shot 2 days now, that's perfectly okay. But it is okay to vaccinate the same day at the same time with both vaccines in different arms. And it's really very, very important because we want to reduce the burden of respiratory diseases. And certainly mask is very helpful, but vaccine is. In fact, during the COVID epidemic, early on, we didn't see influenza, a lot of influenza, I should say, because of our masking. So we continue to do that.
So that's also a recommendation is that masking is something that you would support or recommend as well?
Yeah, we do that. It does reduce the possibility of spread of other pathogens that are transmitted either by droplets or airborne. And that's definition based on particle size, less than 5 microns, over 5 microns. But certainly when we early on in the epidemic, we hardly see any influenza because but we do recommend vaccination for influenza.
And just to also clarify, symptoms are similar in some ways. So if they're feeling like, when that season comes and they've received the COVID vaccine, but they didn't receive the flu vaccine, should they get tested or things like that?
We should be tested. There have been over 200 symptoms related to COVID-19.
Yeah.
From runny nose to headache to rash, cough, you name it. So when we're in doubt, we test people. This is a pandemic, and so we test a lot of people because sometimes clinically we cannot tell. However, having said that, influenza is a very, very specific symptom. And those who've had influenza know it. So influenza is characterized by abrupt onset. You know exactly when you know. High fever. We're not talking about fevers over 100. We're talking about 102, 103, 104. Sore throat, cough, and profound muscle ache. You're in bed. That's a very, very specific syndrome. COVID can cause severe disease. There's no doubt about that. But influenza is very abrupt. Many people say, I got my first symptom at 5:06. It's just very, very specific. But again, clinically hard to tell sometimes, so we're able to test for both COVID and influenza. And there is, sometimes we forget, if we catch influenza early, there are medications, also Tamiflu or Tamiflu. We used to treat influenza. If we make a diagnosis under 48 hours, after the onset of symptoms. So if someone comes in, has symptoms, we'd rather test it and see if they are candidates to treat with oseltamivir or Tamiflu.
I agree. I think it's always important to never assume. So, if I had a patient a few weeks ago that had, nasal congestion for about a week or so that they were sure were just allergies, we did tests and they were positive. Or another kid that had a mild rash and earache, they were positive. We have a rapid COVID machine, which is actually a PCR, which tests for, in addition to COVID, it also tests for influenza and also RSV, which is another common respiratory illness in kids.
So one of the other questions is about the vaccines, specifically since there are different ones. Can parents find information on the Mariposa website or anything about they always ask for the packet insert? Is there information that has that kind of information?
There is. So, if you come to our site at the rec, we have a whole table that's filled with information. So, of course, we give you information on the vaccine. One thing that is unique to our vaccination pod is that we have physicians that are there the whole entire time. So either myself, Dr. Pereira, other physicians, we're always there specifically just to answer questions.
And that's why I wanted to bring that up, because I know that specifically, like at the rec, you're there, or at the clinic, you're there. There's somebody there to answer any questions that parents have, and that's one reason we wanted to have you here tonight. So we thank you again for taking the time to be here with us, because it's we can share that information, but to hear it from right from the doctor's mouth is always better for us.
It's always a good reminder that we use very good and trusted websites. We know that Mayo Clinic is a very good source, Johns Hopkins, Stanford, CDC, of course, and NIH. So those are the sites that people should look up to. We use them all the time. That window's always open in my computer for ready access. And when we don't have the answers, we'll look them up. We don't know everything, so we have to look at sometimes.
So, any other questions?
Are there any specific groups of children ages 5 through 11 that should not get vaccinated? Like maybe those who have significant health challenges, or is that something that we should have parents work with their pediatrician on? Or
It's a great question. So I do recommend, yes, if you have any questions, please consult us. But really, if you look at high-risk groups, you look at kids that have chronic diseases, you look at kids that have disabilities, you look at kids that have severe asthma, those are the exact groups that we actually want to target with the shot. So we recommend that they get vaccinated. Obviously, honestly, even early on, we had people that had a reaction to the first shot, adults. So in almost all cases, in consultation with our allergist colleagues, they almost always recommend that they do get a second dose. So it's very, very, very rare instance where someone would not qualify. Another thing, just speaking of questions, so the American Academy of Pediatrics, they posted some common questions about the vaccine. So, one of them is if a child is 11 years old and then they turn 12, before they get their second dose, what dose do they get? We mentioned that the 11-year-old is the third lower, and they should get that same 10 microgram dose. So even though 21 days apart, if you turn 12, you should still get that 10 microgram dose. Another question that's on the AAP site is, so if a child who's 11 their weight is comparable to a teenager. We have a lot of kids, and even though they're 11, they may weigh 150 pounds. What dose should they get? So the dosing is not based on weight. It's actually based on your age or on your immune response. So they would still get the 10 microgram dose. And then another common question is, if a child has had COVID, should they still get the vaccine? And the answer, of course, is yes. The reason is that while you do produce an antibody response after having COVID infection, the studies have shown you actually do have a higher antibody response and more protection after getting the COVID shot.
Yeah, the chance of reinfection is higher in those who did not get the vaccine following an initial COVID-19 infection versus the vaccinated. But there are some rare occasions where someone was treated with plasma from monoclonal antibody for COVID-19 infection, and those we wait about 90 days. but otherwise, they can be vaccinated after they have recovered from it.
Any other questions?
What is the vaccination rate that we should reach in order to lift any mask requirements? So they're asking, is there a threshold of herd immunity so then we can say that no one would have to wear a mask any longer?
That's a great question. That's a really difficult question, actually. I don't know that I can answer that, to be honest with you. I mean, I think we speak about herd immunity in the 80s. We'd be very fortunate that our community has been vaccinated to a very, very high rate in the high 90s. But we still see cases of COVID around. We have vulnerable people, children vaccinated, immunocompromised, people with cancer. Those people don't respond great to the vaccine. So we continue to wear masks. We still recommend masks until we don't. But it's a great question. I know my answer was kind of a little vague purposely, but I think it's the overall, we have to look at the overall community where we still have populations unvaccinated. Population can get very, very sick. Transplant patients, immunocompromised, cancer patients. So again, still mask. I wish we had a definite number to say we don't need masks, but as far as I know, that has not been concluded.
Can individuals who are 12 and over still receive the vaccine?
Of course, at the
Say
rec-
yes,
Yeah,
yes.
yeah, of course. We'll be there. We'll have the Pfizer vaccine, obviously different dose, so we'll be there to vaccinate. And we still have significant children, right, Dr. Will, that need to be vaccinated. So we're going to be there with the Pfizer vaccine to vaccinate the unvaccinated. So children 5 to 11, those over 12, and parents.
Adults.
So adults too will be there to vaccinate.
And we've gotten a lot of questions too about the Moderna and Johnson & Johnson vaccine in kids under the age of 12. So, we do know that Moderna, they actually have released some data that they looked at a half dose for kids 6 to 11. The initial data looked really, really good. They have not yet asked for authorization, but we expect probably by the end of the year that they'll likely seek EUA authorization. And Johnson & Johnson, they recently started their phase 3 trials for kids 12 to 17. So probably by next year, early 2022, first quarter, we should have a vaccine for kids for J&J as well.
Yeah, for all three, we should by the end of the year have options.
Yes, hopefully, yes.
Great.
And then the last question involves the booster. If an individual has had both vaccine doses and COVID, why do they need the booster? They're asking if they're immune. Why are they not immune? Why would they need the booster?
So I think we'd like to get more information on that individual. I suggest that individual comes to the rec and talk to us. I'd rather not give an answer on that because there may be some specifics that we'd like to know.
Yeah, but in general,
Generally
the booster is
speaking, you're not
recommended.
immune.
Yeah.
In general, the booster is recommended for those who have received the initial vaccination series and those who have been infected. Generally speaking, but
Yeah,
again,
yeah.
we would like.
Yeah, and just like with all medical decisions, everybody's got their own, and it's better to consult with their physician.
But generally speaking, it is recommended. There's a very, very robust response following vaccination versus natural infection. We know that's the future.
That's all?
All right, so anything else before we come to a close here?
I think I'm good, Dr. Williams.
No, I don't. Thank you again. Dr. Pereira and I, we really like giving as much information as we can. So please feel free to ask us. Come to the clinic, come to the rec. We're always willing to answer any questions.
No, thank you for inviting me. Thank you for the partnership, and it's a pleasure being here today.
Well, thank you very much. Again, we're very fortunate to have the partnership and relationship with my blessed and both of you. It's just, trying to keep our district, our students, parents, and our entire community healthy and safe. So again, we thank you. Again, this will be recorded, so it will be out for view. So if you want to share with anybody, you can guide them to our website as well, because that information, I think, is good for everybody. So again, thank you very much.
And we'll be happy to return after we begin our campaign at the rec. We'll share our experiences so far who've been vaccinated and so forth. Happy to come back.
Great,
Thank you.
thank you.
And just one more thing, the district will release an FAQ that has some of the questions we answered tonight, along with additional information to schedule your appointment with Mariposa. Or if you'd like to have your child vaccinated here at school, we'll have information on that as well. And then we also will have an email available in case you want to ask any additional questions. I can make arrangements to have either the doctors answer them or we'll answer them if they involve the district. So thank you all.
Yep, thank you. And again, just as a reminder, this is not a requirement, but it is, we want to provide that information as a recommendation. So